take a look at the screen, because have you heard about this? Santa Claus was having trouble keeping his glasses on during sleigh rides, and they would fog up when he went in and out of chimneys. So Mrs. Claus gave him Lasik for his Christmas gift, and look at him now. He actually looks a little younger without those spectacles, doesn't he? Joining us with more on this painless and quick procedure, welcome back Lasik surgeon and ophthalmologist Dr. Colby Stewart.
Thank you.
Hi there. Joking there, but when you have glasses and contacts, you know, when the weather changes, you have issues with that fogging up and then just having them stay on your face and the whole bit.
Yeah, I mean, I think there's a lot of issues that come with wearing glasses and contacts, and I think some people get to the point where they get tired of messing with contact, waking up every morning, reaching over, getting the glasses, or putting contacts in, contact solutions, etc. And that's usually about the time when they come over and start, you know, or come see me and talk about Lasik.
A lot of people put it off. I put it off for a while and finally had it done. And the first thing I said when I opened my eyes was, why didn't I do this sooner, right? But there are a lot of people who are hesitant because they just really don't know about it. So let's go through some of the common questions and misconceptions people might have. One is, if I get Lasik, I have to get the procedure again in 10 years. Yeah,
I hear this all the time. Patients say, well, if I get this, when will I have to come back? I heard it was 10 years, and I'm not really sure where that came up from, but that's really not the case. When we do Lasik, we're doing it for the long term.
You've changed the eye. Yeah.
That's right. We've changed the eye physically, and patients are going to, you know, they'll come back if they have the procedure when they're 25. When they get 45, they're going to need some reading glasses for things up close.
Yeah, because your eyes just change.
That's part of normal part of aging.
Yeah. All right. I have astigmatism. I heard that I cannot have this done.
Again, another wives' tale that I'm not sure where it came from. Ever since I started doing Lasik 15 years ago, we've always been able to treat astigmatism.
Yeah, I had astigmatism. Yeah.
85% of us have astigmatism to some degree, and Lasik is very, very good and very, very accurate at taking care of astigmatism.
Another misconception, I heard it was a painful procedure. I got to tell you, I laid there and it was like zzz, 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 and then I went, you're done? That's it?
Well, I mean, it's nerve-wracking because people are very, very nervous about anything, you know, just dealing with something as precious as their eyes. Yeah. And a lot of patients are very, very worried about, what if I move? Yeah. What if I'm under there and I do something? You know, I trust Dr. Stewart, I trust the Lasik procedure, but I'm afraid that, what if I move? But we've already taken care of that. We know exactly what we're doing, so we've never had any situations where somebody moved and created a problem.
Other times people say, I can't stand anything that close to my eyes, but I don't know how it works.
Well, we use numbing drops. So we use topical numbing drops, and the places where we need to hold the eye still, we hold the eye still, and a lot of it's just having the patients try to reach, we give them Valium too, a little bit of Valium so their nerves are down and they're relaxed, and we ask them to stare at the blinking light, and to do both eyes usually is anywhere between 5 to 6 minutes.
And of course, after it was done, how long are you out of work or can't exercise, whatever? I just went home and took a nap and just was fine.
Well, you know, the first day, patients their vision is blurry. There's a little bit of tenderness and some burning after for 2 or 3 hours, and that gets better. By the next day, I would say 95% of the patients, depending on whatever their prescription was before, are close to 20/20 vision. So
I had 20/15. I actually improved my vision more than what we considered perfect.
That's right, and they can go back to their regular activities the next day, driving, you know, working out. I usually say a week, and you can take a shower and you can go back to work.
Well, working out's not a problem for me. All right, that wouldn't be an issue. All right, how does the Lasik actually work?
You know, basically what Lasik is doing is we're taking a laser and we're using the laser to reshape the cornea. And most people that have Lasik are myopic, meaning their cornea is very steep, and the laser is actually removing tissue specifically for whatever that prescription is. And you can see, here's the laser center where I work, River Oaks Lasik Center, and I'm looking through the microscope, focusing in on the cornea, and I'm actually having the patient stare at a blinking light. So they're not feeling any pain. We have a little speculum that keeps the eyelids open, so the patient, you know, won't have to worry about having to keep their eye open themselves.
And it's funny because you're aware of all of this. We're not, and so we just lay there.
That's
all
right.
we got to do is lay there.
That's right.
Also want to bring up the point that there are some qualifications. One is 21 years or older, a stable prescription for 1 year or longer. That's why it's important to get your eyes checked every year. Are nearsighted, farsighted, or have astigmatism, not pregnant or nursing, no glaucoma or cataract, and no degenerative or autoimmune diseases. Right. Let's talk about affordability, because that's another thing that stops a lot of people from getting this done.
Well, you know, LASIK is a cosmetic procedure, basically. I mean, you know, nobody has to have LASIK. It's a convenience of being able to live the rest of your life without glasses or contacts. Right. So, unfortunately, insurance doesn't cover it. But I try to set the price where it's something that everybody can have.
Because monthly payments can be as low as $150 per month.
That's right.
All right, and for your eyesight, that's a pretty good deal. Dr. Stewart has a special offer for Great Day viewers, $1,000 off blade-free LASIK for patients who schedule a free consultation by December 31st. Why not get your eyes checked anyway? That also includes any medications needed for the LASIK procedure and a year of post-operative follow-up and care. Check out stewartlasik.com, or you can call this number, 713-358-4340, 713-358-4340 for more information. Thank you very much.
Thank you so much.
When we come back, this